Carol, one of SIA's spinal cord injury nurse specialists. And I wanted to take this opportunity to try and clear up some of the confusion about the care plans that SIA have available for their members, and why we think it's necessary to have 2 care plans. So the first care plan, which is available from the SIA website, which you can print and actually complete yourself or with the assistance of one of your family members or your carers, is my personal care plan. Now this care plan is for you to document what your usual care needs would be on a daily basis. And this can be really useful if you were to be having a social services assessment or a continuing healthcare assessment. If you were to be going into hospital for an elective minor operation where your level of dependency and your ability to communicate your care needs wouldn't really be compromised, but it's a really helpful document for them situations. The emergency care plan is a document that needs to be completed by one of SIA's specialist nurses. And the reason for this is it allows that document to have clinical validation. And so for this document to be completed, you would need to have a conversation with one of the nurse specialists, and we would then complete this the document for you, complete the emergency care plan for you using more clinically based language. And then we would then convert this document into a PDF and send it to you for you to then use if you were to be admitted in an emergency, or if you were very unwell when you needed to go to hospital. Now we think this document is necessary because many people will tell us that they feel safe when they go to a spinal cord injury centre rather than if they were admitted to a district general hospital. Now it's not because the staff at the district general hospital are less caring than the staff in the spinal cord injury centres. It's just that the staff in the spinal cord injury centre know when to intervene. They know when your level of dependency has changed. They know what elements of your care needs need to alter during periods of illness. And because sometimes as a spinal cord injured person yourself, you may not be aware of what aspects of your care may need to alter. And what I mean by that, for example, is when we're completing the care plan with some of the members, and the members will tell us they don't need an air mattress and they can turn themselves, and they will do this every 6 hours, 8 hours, even overnight. While that's fine when you're healthy and well, when you are admitted to A&E and you are on perhaps a hospital trolley, or then you're being transferred to a hospital bed, this element of your skincare regime may need to change. So for example, we would recommend that you are transferred onto a pressure relieving mattress as soon as possible, that you're offered and assisted if needed to change position every 2 hours. Now if you're well, you can decline this, but if you are unwell and you're not able to communicate the importance of pressure area care, well, this document states that. Other aspects of your care that may need to change may be that if you do intermittent catheters, or you have a suprapubic catheter with a flip flow valve, it may be that if IV fluids are being administered, then that form of bladder management is no longer appropriate, and it may be that you either need an indwelling catheter in or a free drainage rather than flip flow valve. And again, bowel care, it may be something that you would normally transfer onto a toilet to do, but if you're unwell, it may need to be undertaken in bed. So I hope that explains the difference and why we have the different care plans. And if any of you would like an emergency care plan completed, please get in touch with our support line, and they will put you through to one of the specialist nurses who will assist you to complete a form and then that can be used if you should go to hospital in an emergency. We have managed in some instances to actually get the emergency care plan uploaded into a person's electronic hospital records, which means as soon as they are present at A&E, that is flashed up on the electronic patient record that they have a spinal cord injury and they have some very specific care interventions that need to be adhered to. So, of course, this is something that may not be possible during this period of coronavirus and the NHS being so busy in saving lives at this time, but it is definitely something that following this period, when things return to normal, that we would encourage you to do. If you have any further questions regarding the care plans, please see our forward article in the February issue, where Helen, my colleague, the nurse advisor, has explained the care plans, and also this will be on our website soon, that article, just to make things a little clearer. But if you still need to discuss anything else, please don't hesitate from getting in touch with us. I hope you all remain safe and well,